When people talk about communication skills, they talk about the words we use, the tone of our voice, or our body language. But sometimes the most important thing you can say is nothing. The sound of silence, at times, can have the biggest impact. Welcome back to Clinical Communication. My name is Ben. I'm a specialist physio and clinical communication skills facilitator here in the UK. And today we are talking about silence and when to say nothing. And as you heard me say, silence or pause can have a big impact with that person in front of you, may allow you to get more information or build a greater relationship than you otherwise would have done. We'll be going through some examples today of where it's useful. And if you found this beneficial, as always, please follow or subscribe wherever you're listening to it on. Using silence can be quite a powerful tool because in society or as humans in general, whenever there's silence, we can feel a bit awkward. We want to fill it. Okay, we don't like just sitting in quiet, silent points, especially just with one other person. Now, when you're using it in practice, silence doesn't have to be literally staring at the person in front of you, waiting for them to respond. You could be doing something else while being quiet. That might simply be typing and making notes, okay? Or writing something down, or going to collect something. But when there's silence, patients can be quite inclined to fill it, or express an emotion they otherwise would have been holding back. But when should we be silent or pause? Well, the first obvious one, as I've said in the past, when someone's telling you their story or giving information, obviously you're going to stay quiet and don't interrupt. However, it can then be natural once it appears that they've finished telling their story that you then want to chip in and maybe repeat back what you've heard or ask extra questions. But before you do, just delay your response by a few seconds, maybe up to 5. Because the patient in front of you may be thinking of anything else they want to tell you. Maybe if they felt they're able to tell you things, they may then come out with that thing they haven't told anyone else. So the first major use of silence or pause is just after they've told their story. Doesn't have to be very long. We don't talk in 10, 20 seconds plus. Just a few, maybe 5 seconds, and just pause and then follow up with whatever you want to say. If done right, this is classically the moment where the feelings will begin to come out and how they feel about the situation without you having to ask them. They'll tell their story, they'll tell you what they think you should know, and then what they want to tell you. And that little pause, many people I see will go, what I really feel about it is this. Or they may even start to cry or show some frustration or whatever emotion they're feeling. So again, the benefit of just allowing that little pause after they've spoken will just maybe get you some extra information, be it verbal, be it emotional, that can help give you a better idea of how it's affecting them. In addition, after that, once they've told their story and you're repeating back what you've heard, you may demonstrate some empathy by using a label. Now, whenever you're using a label, so something like, that sounds like this has been really difficult, it looks like you don't know where to turn, whatever it is, you've used the appropriate tone, pause. Because you need to know from them if what you said is right or wrong. Okay, so they can correct you. In doing this, not only will they be able to confirm if you're right or wrong, but again, they may give you more information. Using these labels often helps open up that emotional part of them. Telling someone it sounds like it's been really difficult, they may say, yeah, and it's because I'm really struggling at home, or I'm not coping financially anymore, whatever it is. Again, it may get you that extra information, especially more emotional information, to give you a better idea of where they're coming from. And it's during this subjective, especially if you're getting quite a lot of personal or detailed or intense information, actually sitting and just typing some information down with those little pauses or little bits of silence gives the person in front of you time to breathe and just relax a bit more or reflect on what they've said so far and how you're making them feel. And hopefully, if you're making them feel supported, making them feel heard and listened to, and that they can trust you, and again, you may get more useful information, more information they may not have told anyone else. It should also be obvious that if during your assessment you're asking them to maybe read something or write something down, As they're doing it, again, stay quiet because they need to focus on whatever you're asking them to do. Don't distract them with the words you're going to say because it's going to put them off whatever they're trying to do and they can't focus. So if you're getting them to do a task, whether it's writing something down or making notes or whatever it is, just again, stay quiet until they come back to you. And then the other part of when to use silence really effectively is when you are giving new information. So let's say you've asked all the questions you want to ask, you've done whatever objective assessment you want to do. It's come to that point where you need to either explain what's going on or give them information about how to manage this situation better and how to treat it. So ideally, whatever information you're going to give should be given in little chunks, okay? Not big bits of information that are hard to take in, but little bits that they can take in parts and you can check their understanding along the way. Whenever you've finished a chunk, pause. By doing the pause, you're just allowing them to process what you've said so far and just take it in. And if they want to ask questions at the point, do. It gives you an idea of how they're feeling. They may nod along. They may go, well, they may tell you actually why you're wrong. Who knows what they're going to say? But whenever you're giving this new information, do it in little bits. And then after each little bit, pause to allow you to see what they're going to say and give you an idea again of how they feel about what you are saying. The classic example that everyone thinks of with this is around breaking bad news. So here's an example. I remember seeing a lady in the past. She was under our service for her, we'll say, back and leg pain. She was really hoping she may be able to get some surgery. It had been discussed with the surgery team and they felt it wasn't going to be of benefit. So I, as a leader of her care, phoned her up to tell her that it wasn't going to be appropriate. We went through the breaking bad news process, which we can cover another time. And whenever you're giving bad news to someone, once you tell them clearly what it is, you then pause. Now, this was made extra challenging because she was over a phone, so I couldn't see her emotional reaction. I could only hear it. And what she was hoping for, sadly, wasn't on offer, and she became quite upset. But I paused. I let her react, okay? Because I didn't know how she was going to react. You don't always know. Sometimes bad news can be good news for some people. They may be upset by it, they may be angry, they may be relieved. Who knows? But you pause and stay silent after you give the bad news to see how they react, and then you can react appropriately. Again, this principle can be applied to whenever you're having to give information, whether it's about explaining a certain diagnosis or someone's treatment options. Have that pause and again allow them to react because they may not react or think the way you're expecting them to react or to think. Now, the key question I always get asked is, how long? How long of silence do we leave it? Well, it varies. There is no textbook answer. You're going to have to do a bit of gut feel, but there are maybe some clues you can look for with the person in front of you as to when to say something. Whether it's getting information from them with your questions, or whether it's seeing how they react after information you give them, a clue that maybe someone's thinking about what you've said or any extra information they want to say, whenever we are contemplating those things, we'll often look away, often up into a corner or down somewhere. If they've said or they're reacting to what you've said and they're looking down or in a corner, and you can tell they're contemplating it, then allow the silence to happen. And they will probably come back to your eye level and say something when they're ready, depending on how they feel. If they're not doing that and they're kind of giving you the eye contact and they're nodding and they're kind of leaning in, they're probably giving you the impression that they want you to say more, or they don't know what to say, perhaps. And the other part of knowing how long silence to use, apart from getting information or seeing how someone reacts, it also allows potential emotions to cool. So if someone's very upset and down and depressed, you're not going to be happy, clappy, loud, as I said to you previously. You're going to match or come down to their level. And that may mean being quiet and allowing longer pauses so they feel more comfortable to start speaking. Sometimes people need that time and space and just presence before they feel able to come out with stuff. Or if someone's very angry and emotional, sometimes having those pauses, staying calm, allows them to breathe out and reflect, and then simmer down. So you can also use it to bring some balance to the emotions of the situation. But overall, using silence or a pause, there is no perfect time. Judge it on the person in front of you, read the room, depends on the situation at the time. If they're giving information, allow a little pause after whatever they've said, because they may just tell you a bit more about how they truly feel. After you have given some information about the diagnosis or treatment plans or something else, pause, see how they react. And whenever emotions are particularly heightened, use some silence or again a pause, and it may help the emotions cool down and come back to more balance. If you found this useful, then as always, please do go and share it with other people. Please give me a follow on whatever social media you're on at BYBrowPhysio. Do subscribe if you want to. Thank you for listening or watching, and I will see you next time.